Welcome back to Girl Talk. We are now joined by Dr. Stuart Smalheiser, a board-certified cardiologist at Beaufort Memorial Low Country Medical Group, and Pauline is still with us, and Aaron. And Men's Health Month is right now. We're talking about some of the biggest issues that you see with your men in the cardiology department.
Men's health is probably at least 50% of our business. Heart artery disease, so heart attacks, blockages in the heart arteries, heart failure, heart rhythm problems, and valve problems. And that's 99% of our business on a daily basis. I think one of the things you guys want to know is how do we prevent heart artery disease?
Right.
One of the things that I try to focus on with patients is reducing risk factors. So diet, exercise, going to your primary care doctor, making sure that your blood pressure and cholesterol are in control. And if you have symptoms, make sure you seek medical attention quickly.
So what would some of those symptoms be?
If you read the textbook, the classic signs of a heart attack are pain in the chest that's often worse with exertion, often relieved with rest or nitroglycerin if you have it. And oftentimes that pain radiates down the left arm or to the left jaw. Sometimes people break out in a cold sweat. Sometimes people get nauseated. But if you look at the data, only about 50% of people get classic symptoms. 25% of people have no symptoms at all, and another 25% of people at least have atypical symptoms.
Okay.
And what is an atypical symptom?
So it could be anything from nothing to essentially right out of the textbook. So some people may just get nauseated. Some people may just kind of have a cold sweat. Some people may have chest pain, but it may not be on the left side of their chest. It may be in the middle of their chest. It may be, even on the right side. As someone who's been doing this for a while, I've heard everything under the sun as far as symptoms, and I take all of them seriously because you never know who's really having something real and who's not.
Right.
So do people pass a lot of those symptoms off as like indigestion or other things, and then they don't get in? And is that why the primary health screening is so important?
So there have been people who've had indigestion who thought it was just heartburn from dinner and have had bad outcomes, and unfortunately it's hard to know what's real and what's not, and ultimately you'd like an expert to make that decision. You certainly don't want to bet your life on.
And age isn't always a factor. Is that true? You could be a younger person that might have that history.
You never know who's going to have events. I've had patients come in and have heart attacks who are as healthy as you can be, younger, female, and I've had their heart arteries blocked, and then again as well, I've had just as many people who have every risk factor in the book, who have had the best story, and their arteries are cleaner than mine.
Wow. They're still eating the bacon on the burgers.
They're probably still eating the bacon.
So Men's Health Month, and we're talking about the guys, but women kind of are a little bit different a lot of times when it comes to heart issues. How does that change between the men and the women?
So most of the symptoms that we think are classical symptoms were based on what kind of older men had, and that's where everything was described. And as we've taken care of more and more people, we've realized that women, older people, people of different ethnic groups have different symptoms or describe symptoms differently. And so as we kind of branch out from what the textbooks describe, we have to be more and more careful and take more and more symptoms seriously, because not everyone presents the exact same way.
It's Men's Health Month. We've been talking about screenings. Pauline, thank you for joining us, talking about all those routine screenings. Men's Heart Month and making sure that your heart is in good shape and what to do with it. Dr. Smalheiser, thank you so much for joining us. And the ladies, don't forget about those symptoms that could affect you too. Don't go anywhere. We'll be right back with more Girl Talk.